I read a couple of Diana Diaby's articles on connectionmatrix.org, and I think they're an excellent source for anyone who wants to learn more about the Arab culture and Arab clients, especially speech language pathologists and other healthcare professionals. Diaby is a bilingual speech language pathologist who specializes in AAC systems, especially for children who are bilingual in Arabic and English. The first article written about cultural considerations when working with Arab families and their children with complex communication needs. Consanguineous marriage is common in the Middle East. So it's common for men and women to marry their first or second cousins, and there's many reasons for that. Some of the reasons include wanting to increase the family surname, which is very important in the Middle East for families to preserve that surname. Another reason is because they know each other's reputation. Again, reputation is also very important for Arab families. Also, to ensure that the family business stays within the family and outsiders aren't coming in to interfere with that family business. Personal space is another topic covered in this article. So it's very different in the Middle East because people of the same gender tend to stand much closer to each other than they do in the United States. However, men and women engaging in a conversation have to honor that personal space much more. So while it's typical for two women or two men to slightly touch each other's arm, hand, or shoulder in a friendly or endearing way, it's not typical for a man and woman who are not related to touch each other in any way. Something else that's highly honored in the Middle East is hospitality. Arabs enjoy inviting each other over, and it isn't uncommon for families to invite over doctors and clinicians who are working with them or their children. It's their way of paying the doctors and clinicians back for taking care of them and treating them. But of course, it isn't always appropriate or allowed for a clinician to form relationships outside of work with their client, so it's appropriate to respectfully deny that invitation if necessary. In the second article of cultural considerations when working with Arab families and their children with complex communication needs, Diaby's colleague had an encounter with a Muslim family when she invited the child's parents to participate in floor play with their child while doing a therapy session. The speech language pathologist was left confused when the parents refused to get down onto the floor to play with their child. So the Abbys had to explain to her colleague that for Muslim people, the floor is considered unclean because there have been shoes that walked all over it. This signifies uncleanliness. Muslims take off their shoes and get down on the floor to pray 5 times every day. The reason they take off their shoes is because for them, shoes create uncleanliness. This might be a reason why the child's parents did not want to get down on the floor, which is considered dirty with shoes. Cleanliness is very important for Muslim families. Some solutions that the Abbys offered are asking the parents where they prefer to sit during their child's evaluation, or finding out if the parents are religious because not all Muslims follow strict religious guidelines. In another article titled No Tech AAC Considerations for Arab Clients with Complex Communication Needs, Diaby's was conducting a therapy session with a Syrian girl. She was trying to teach the patient how to sign for words such as please and thank you. The sign for the word please was rubbing the chest with the hand. But the mother quickly interfered with the therapy session, telling Diaby's that it's inappropriate to rub the chest around family and friends. Instead of being prejudiced and thinking that's weird, Diaby's was open-minded to the fact that other cultures have different social standards and norms. So Diaby's worked together with the family to come up with a different, individualized sign approved and agreed upon by the family. So Diana Diaby's mentioned some gestures and what they mean for Arab people. So when greeting someone of the opposite sex, you're not supposed to touch them or shake hands or hug or anything. Instead, you just put your hand on your chest and bow down a little to say hello. In the United States, usually students will raise their hand in class when they want the teacher to call on them. But in some countries in the Middle East, it's normal for students to raise only their index finger. So during a therapy session, if a student wants to, or if a child wants to say something, they might just raise up their finger indicating like, can I talk? Am I allowed to say something? So speech language pathologists should expect that from Arab children during therapy sessions. Another gesture that Arabs might use is putting their hand on their head and saying ala rasi, which literally translates to on my head, but figuratively it means it was my pleasure or it was my obligation to do this thing if you're thanking them for something. Doing this means be careful or wait a minute. Biting on the lower lip and raising the eyebrows means something is shameful. So a mother might do that to her child to indicate that she wants them to stop doing whatever it is that they're doing. This means I have no money.